Hello there, I am Dr. Camacho, an ear, nose, and throat surgeon. In this video, I'm going to explain ear tubes, why we place them, and some anatomy that you need to understand, as well as the risks, benefits, and alternatives. Let's look at the anatomy. First off, you have the outer ear shown here. The next area is the ear canal. Sound travels from the outer ear through the ear canal. The eardrum is shown here. It is very thin, but it vibrates. And when it vibrates, you have these bones shown here in blue, light blue. And that causes a fluid wave which travels into the cochlea. This is like the sound organ. It vibrates hair cells that have nerves, and the nerves then transmit the sound to the brain. This space in here is called the middle ear. And below that, you have what's known as the eustachian tube. What's interesting is that the ventilation for the ear comes through that tube. And if you notice here, this opening is the same as that opening in the back of the nose. Therefore, when you think of eustachian tube, don't just think of the ear. You also need to remember that there is the hole that drains the eustachian tube in the back of the nose. The reason that's important is this movement of air through here allows for equalization of the pressure inside the middle ear with the pressure in the back of the nose. So this is the eustachian tube. The reason we put ear tubes, as shown here in green, is that in patients where the eustachian tube is not working properly, this then allows the ear pressure inside the middle ear to equalize with the pressure in the ear canal. What's normally supposed to happen? Well, when you swallow, when you pinch and blow your nose, you can see that the eustachian tube gets dilated. So here it is dilated, here it is not dilated, and that is normal for the eustachian tube to open and close when you swallow, when you pinch your nose and blow. And when it's not working, that is known as eustachian tube dysfunction. Another thing that you need to know is that children, when they're newborn, tend to have a eustachian tube that's around 10 degrees from the horizontal. You can see here in this younger child that it's about 10 to 15 degrees. Once you are about 8 years old and older, the eustachian tube drops, and that allows drainage from the eustachian tube into the back of the nose. But you can see here that as you get older, it's much easier, and that's why younger kids tend to have more problems with the eustachian tubes. Here's the eardrum. There's a lot of structure shown here, but what you need to know is that in kids who have recurring infections, you get a lot of blood vessels here, and the infection can build up pus, and in some cases, it might drain on its own. Sometimes we need to put ear tubes. Here I am showing an incision being made into the eardrum. Once we make the incision, we can suction the contents out and place an ear tube. Now, this surgery is done in the operating room in kids. If it's an adult, we can often do the surgery in the clinic. We just stem up the ear. We use a speculum, a microscope. When we do that, we then choose the type of ear tube that we want. This top one, shown in A, is small. It's about 2 millimeters in size, and that one tends to last about 12 to 18 months. This middle one here may last about 2 years or so. And then in some cases, it may last 2.5 years or 3 years. And this bottom one here, shaped like a T, is known as a T tube. And that one can last up to 5 years. Here is the eardrum, and you can see the anatomy. There's a bone here. There's the eardrum itself. The eardrum is very thin. There are 3 layers, but we can really see through it. It's so thin. And what we do is we go to the operating room, we use a microscope, make an incision. Once we make the incision, if there's any pus or fluid in there, we suction it out, and then we place the ear tube. And after the surgery, we typically want to make sure that We don't get the ears wet aside from eardrops that we prescribe for at least a few days. And typically we'll prescribe eardrops that you place 3 drops 3 times a day for 3 days. That is ciprofloxacin. It just depends what is available depending on the location. And after that, whether you get your ears wet or not depends on the surgeon. In the United States, typically children are allowed to go to the swimming pool or the ocean, but definitely not fresh water or dirty water like lakes or rivers because that can contaminate the middle ear and cause an infection. Risks of surgery include bleeding, infection, and need for more surgery. Sometimes the tubes will fall out too early, meaning within a few months of surgery. And if that happens, we may need to replace the ear tubes or just kind of reset the clock and say, okay, now we're going to start over again, as if the ear tubes had been fallen out at the normal time. Typically, we will place ear tubes if there are 3 infections in 6 months, 4 infections in 12 months, and also if there's fluid in the ear because that decreases the hearing. And often we may get a hearing test to verify, or what's called a tympanogram to verify that there's been fluid. And the goal is to help kids so that they don't have speech delay, because if they can't hear very well, then obviously it can cause problems with hearing in school. In some kids, the ear tubes will stay in for too long, meaning it lasts more than the expected 1.5 years. Let's say the tubes are still there 3 or 4 years later. We may need to go to the operating room, have the patient go to sleep, pull the ear tubes out, and then we may either put a paper patch or sometimes we'll put fat in the hole. It may depend on how big the hole is and how long the ear tubes have been in place. Disclaimer: this video is strictly for educational purposes. It is not meant to provide specific medical advice, so please seek professional medical assistance. The illustrations and content were created by Dr. Camacho. Thanks for watching. Bye.